and welcome to the VieSID press release. In this video, we report on the dental literature published in March 2022. We have chosen articles from a selected list of journals that we think might be of interest to the VieSID community. Let's begin. We begin with an editorial in Cranio by Hobson and Desser, who discuss the benefit of using equalizer to detect descending effects of imbalance occlusion on the neck and back, including the pelvis. They reported on an experimental study by Hobson that, following observation by Dr. Shapira, used equalizer on 27 patients complaining of TMD pain and showing uneven iliac crest height. They reported that allegedly after walking for some minutes while wearing the splint, 19 patients corrected the asymmetry, 6 improved it, and 2 reversed it. They explained these results with the fact that premature contacts cause the patients to tilt the head towards the side where the premature contact is occurring, thereby causing a shift of the weight to the contralateral side and thus an asymmetry in body posture. The use of equalizer functioning based on the Pascal law, stating that a pressure change upon a confined incompressible fluid is transmitted through the fluid such that the same change occurs everywhere, should have compensated the occlusal imbalance and consequently the asymmetry in the posture and the asymmetry in the iliac crest height. They also suggested that in the individuals in which compensation is partial or overcompensation occurs, an involvement of the soft tissues or different length of the legs could affect the outcomes. So thus they suggested that further studies verifying the length of the lower limbs at the trochanter should be performed. They recommended the use of the equalizer as tool for the assessment of a descending effect of malocclusion on the neck and back. While reading this contribution, you should keep in mind that this was an editorial and is not structured as a research paper and does not follow the requirements of a research paper. Therefore, we can consider the study as a pilot study, which might have promising outcomes that should be accurately tested. Cranio hosted an exchange of opinion between Jens Turp and Roger Solo on the importance of centric relation. In November 2021, this journal published an editorial by Turp titled Centric Relation from Red Giant to White Dwarf, which can be summarized as follows. The term centric relation is controversial, thus confusing. Healthy dentate individuals show a remarkable variability in the location of the condyles when the teeth are in maximum intercussual position. Thus, the goal is to achieve a reasonable condylar position while treating patients. Afterwards, both the new tooth relation and the new jaw relations are gradually normalized by cellular remodeling, and occlusal and condylar stability can be expected in the vast majority of cases. Solo commented on Turp's statement, which, in his opinion, do not have scientific support and instead stressed that treatment based on maximum intercuspation leads to unstable and unsatisfactory results. He claimed also, and I quote, "There is a clear anatomical biomechanical rationale for using centric relation for occlusal analysis and predictable treatment with restorative dentistry, orthodontics, and orthognathic surgery." He also gave a great emphasis on the importance of muscle activity in determining condylar position. And Turp replied, but to my opinion, quite elusively. According to Turp, there are two ways of looking at the stomatognatic system, a mechanicistic approach occlusion-centered as that of Solos, and the biological approach that Turp himself embraces. And these two are incompatible, and thus it's stated that their respective views cannot be reconciled. I must admit that this statement puzzled me quite a lot and made me fear that the health of the stomatognatic system depends on some beliefs rather than clinical and scientific hard facts. Also, I do not see any incompatibility between mechanics and biology, since biological entities are subject to the laws of physics too. So why not thinking of a comprehensive and integrated approach to oral health? Turp also stressed that the intra and inter-individual variability of biological and thus human phenomena is great. And in a sort of romanticism of oral health, he actually wrote that human variation is so great that a comparison of humans with technical devices is not permissible. Each individual person is unique, while machines produced in large numbers are identical and function identically. And I would say, yes, tools and machine have to be like that. I'm firmly convinced that the interpretation of biological variation requires accurate and reproducible methods, as well as precise tools, which are meant to minimize the intra and inter-observer errors so as to obtain reliable results, without diminishing human variation, but also avoiding to confound the biological signal with random noise. As biologist and morphometrician, I overturn Turp's statement by saying that because of human biological and morphological high variation, it is imperative to use precise tools for sampling data and accurate and reproducible methods for analyzing them to make sure that individual characteristics are properly rendered. Only through a scientific approach and within the context of biological knowledge can we interpret the human oral condition. In Cranium, Chen and colleagues evaluated the effect of mandibular advancement device in the treatment of obstructive sleep apnea. They considered 380 patients with mild to severe obstructive sleep apnea, which were recommended for mandibular advancement therapy and could not tolerate the use of continuous positive airway pressure, or the CPAP. The mandible was initially advanced at 60% of patients' possible advancement. Then the patients were asked to perform a titration every 2-3 days until the device reached an optimal position or caused any side effects. Unfortunately, this paper suffered from a bias of the result report, and the figures are not consistently reported in the abstracts, tables, and text. However, we can summarize the outcomes of this paper in saying that approximately half of the patients underwent full treatment, including the 1-year follow-up. So of these, most of them, so 65 of them, reported an improvement of the symptoms related to obstructive sleep apnea. So, however, over 50% of the total number of patients reported side effects, mostly TMD symptoms or dental problems. Based on table 4, the authors reported that 1 out of 4 patients discontinued therapy before 1 year, either because of the presence of symptoms or lack of efficacy of the therapy. However, we know that only 43% of the patients completed the 1-year therapy. Therefore, I would say that at least 2 out of 4 patients discontinued. So anyway, I wonder whether the titration conducted autonomously by the patients represented one of the reasons for failure of this approach, but it definitely made the effects of the treatment difficult to control in the study. The Journal of Prosthodontics hosted a review paper by Goldstein and Campbell to make a consensus statement on the DAL concept. Over 4 decades ago, Dahl and Krogstad put forward an orthodontic technique for the treatment of severe wear of the anterior teeth. They used a removable metal platform, as in the photo here that I chose from Poyser et al. 2005. And this removable metal bite platform was used to create interocclusal space, induce intrusion of the anterior and extrusion of the posterior teeth to allow space for the restoration of the anterior teeth. So Dahl and Krogstad hypothesized that 60% of the space achieved derive in fact from intrusion of the anterior teeth and 40% from extrusion of the posterior teeth. Goldstein and Campbell found out that the literature does not provide enough evidence on the efficacy of the treatment. Moreover, it was not demonstrated how the space at the front was achieved, where it was postulated that rather than in intrusion and extrusion of the dentition, the result was achieved because of a rotation of the mandible. The article review revealed also a high incidence of adverse effects of this treatment, including dental abrasion or damage, periodontal damage, and TMJ pain. In this article published in the Journal of Craniomandibular Function, Manfredini et al. Investigated the correlation between dental wear and nocturnal masseter activity in a sample of 41 adults and young adults, and did not find significant association between these two variables. Based on these results, the authors observed that dental wear is not only caused by attrition, which is the tooth-to-tooth wear, but also by erosion, so the wear by chemical action, and abrasion, the tooth-to-foreign material wear. Thus, the presence of dental wear does not unequivocally reflect bruxism. While I find the author's conclusion correct in principle, I have reservations with regard to the study design, in particular the sample selection. Besides the fact that their sample is rather small, counting only 41 individuals, dental wear in their sample is mostly light, thus possibly excluding actual bruxers. They report a normal distribution of the degree of wear, but in fact, this study would not have required the presence of a normal distribution, rather of a balanced sample size for each main category of dental wear, with equal representation of light, moderate, and severe dental wear. For what concerned the muscle activity, the authors consider muscle contraction exceeding maximal voluntary contraction forces by at least 10%. And considering that this was an explorative study, I wonder whether the authors could have tested whether dental wear is associated to force of involuntary muscle contraction exceeding by 5%, 10%, 50%, 15% or more maximum voluntary contractions. It is also difficult to evaluate the outcomes because of lack of proper report of the results. The authors did not find a linear correlation between the variable analyzed, namely dental wear and muscle activity, but could have been a non-linear association between the two. In summary, I think that the sample used in this study is not adequate to test the hypothesis laid out by the authors, and moreover, the collected data are insufficiently analyzed. In the Journal of Craniomandibular Function, Turp wrote a piece in memory of Professor Rudolf Slavicek, the founder of VieSID, deceased at the beginning of this year, unfortunately. He remembered discussions with him and described his moral integrity as a person and doctor, stressing his role within functional dentistry with kind words, reflecting his respect for Dr. Slavicek. He mentioned Professor's main achievements, his passion for the human sciences, his numerous publications, and within them, his book, The Masticatory Organ. Also, Turp acknowledged Professor Slavicek's dedication to teaching, and within his achievements, he mentioned the establishment of VieSID. We of VieSID want to thank Dr. Turp for this article, for his kind words, and invite you all to read it. So this presentation finishes here. I invite you to contact us in case you want to know more about our activities, and otherwise be ready for next press release. Best wishes to all.